If you find yourself dealing with achy, heavy legs, that could be a sign of a problem with varicose veins. At Milligan Vein, Dr. James Gooden relieves that pain for people every day, and he joins us this morning hoping to help you as well. Good to see you.
Hi, thanks for having me.
So is that typically the first sign people have, the achy pain, or is it often a visual first of a problem with a varicose vein?
I think it's both. I have a good number of folks who come in to see me who are alarmed by a new spider vein or a bulging vein that they've noticed in their leg. But when we kind of sort of peel back the layers and start to talk to them, quite frequently we find out that they've been just dealing with achy pains, heaviness in their legs, tired legs all the time, and just kind of put the blame on just getting older.
Yeah, or sometimes if it is something chronic, you just do kind of adapt and learn to live with it.
And you
and
don't even realize it's going on.
Right.
Yeah.
Okay, so different people have different pain tolerances.
Right.
I think I've heard you give an example before of if you go to the mailbox and by the time you get back into the house again, you're kind of tired. That could be a good sign.
Definitely could be a good sign. I sort of an underlying thing that I hear from most of my patients is the fact that they're limiting their quality of life, and they don't even realize they're doing it. They're not getting out as much, they're not shopping as much, they're not spending as much time with family. This year, coming into the last part of the year and the holidays, a lot of people sort of come to the realization that they can't quite get around as well as I used to. And
yeah.
It might be a good time to come in and get your legs checked out.
Okay, so first of all, what does it look like to quote get your legs checked out? What are you doing?
So we do go through a process. You don't come and see me on day one and we just fix everything. So you come in for just a consultation and I get to know you, you get to know me. We talk, I give it a little 5-minute science lesson on what vein disease is all about, and we talk about how we can fix these things. Obviously we do an exam, make sure it's not just generic leg pain that someone's coming in to see me for. I mean, there's a myriad of things that could cause people to have pain in their legs. And then once we're kind of honed in on vein disease being the culprit, then we get an ultrasound. We set you up with some non-operative therapy, which entails just elevating your feet at the end of the day, wearing some prescription grade compression stockings, and seeing if you get any relief from that.
The prescription grade is important because it's a different level of, I guess, of tightness, right?
Right. Most people that come to see me that have already had some experience wearing compression hose or just wearing sort of the knee-high stockings, and just based on the guidelines that we follow, the stockings need to be at least a thigh-high compression stocking. Some people wear the leggings. But in terms of the strength of compression is really what I mean when I say medical grade or prescription grade. It's what we call 20 to 30, and that's just a reflection of how tight they are.
You mentioned earlier that sometimes people come in, they have noticed some spider veins. Does a spider vein lead to a varicose vein problem?
I mean, it can. Spider veins, to me, it kind of runs a spectrum. And you can have just a run-of-the-mill spider vein that can pop up in someone that doesn't have what we would really consider treatable underlying disease, and then on the other hand, it's frequently just a red flag that there are some bigger issues beyond what we can see with our eyes.
So besides the achy, heavy feeling in your legs, it can lead to much greater health problems, right? Because that's essentially a clot that could.
Well, it can, and there's. Yes, poor venous circulation can put you at risk for blood clots. It can, over time, there's two issues going on with vein disease. There's too much pressure in the veins, and there's a source of inflammation. And that inflammation, chronically over time, will damage the tissue in your legs. It will cause the skin to turn color, and ultimately can lead to chronic wounds and ulcers that just spontaneously occur.
Are they typically hereditary? Is it a genetic condition, or do lifestyle issues affect it?
The biggest risk factor is genetics. Folks who get vein disease basically have just genes for stretchier veins than folks who don't. And then there's also the lifestyle, environmental factors, injuries, having had previous surgery. Women are more likely. I find that folks who have standing or sitting for long periods of time and not a whole lot of lateral movement, those are the folks whose lifestyles tend to exacerbate their underlying vein disease.
And I cut you off. I think you were saying women. Is that because of pregnancies? They put more stress on your body?
Well, there's the physical aspect of that, where a pregnant uterus puts pressure on the veins coming out of the leg, on the vena cava. There's also hormonal differences between men and women, and those hormonal differences affect the compliance of veins or how stretchy they are.
If you do have to treat it in ways other than the compression stockings, if you go in to do it, what are you doing? What's the surgical treatment?
Right, it's very simple. You've got a redundancy of veins in your legs. So what I mean is you've got many more veins in your legs than are essential.
Okay.
And so we do an ultrasound. We find to sort of hone in on where exactly the problem is, and then once we've identified that, we essentially get rid of the bad veins and we leave the good veins behind, and by doing so that improves the venous circulation out of the leg. Getting rid of the vein is a much less invasive process than it used to be.
So you actually remove the vein, or you just tie it off?
A little bit of a figure of speech. So what we do is mostly we do some of that, but the majority of what we do is what we call endovenous surgery. So these are procedures where we run a catheter through the vein and basically kill the vein from the inside.
Huh.
So,
and is it like a day surgery? You just go home?
It's usually you're in and out of my office in an hour.
And do they tend to occur more in the calf area, or do you have them in your thigh as well?
It can involve the entire leg. People's symptoms tend to be more prominent in the lower aspect of the leg, and that's probably just due to the fact that of gravity.
Right.
And
Just a quick question. Does it tend to happen on both legs, or if you're not properly aligned, if you have back issues, can that put more strain on one side of your body than another?
Well, there are some underlying medical conditions that come to mind. That can cause you to have asymmetrical presentation of this. Basically have a normal looking leg on one side, and often May-Thurner syndrome, for instance, where you've got sort of a bottleneck in the venous flow on the left side, and it causes you to have a fairly significant varicose vein disease on that side, while the other side looks fairly normal.
Okay. All the things you learn when you talk to the doctor who's here with us in the studio, you can talk to him as well. It's Milligan Vein. They have 2 locations in Cleveland and then also up in Athens, right?
We have a office in Cleveland, Knoxville, Crossville, and Morristown.
Okay, I had it wrong. Cleveland's the closest one. That's where you go to find him. 961-5682. Online, it's milliganvein.com. Thanks for the education.
Thanks for having me, Julie.
Technology is everywhere. Count on local